Welcome to the Omni Dental Podcast, and this is the brief on a new laser study regarding peri-implantitis. As the premier practice for Arlington Heights and surrounding communities like Buffalo Grove and Palatine, today we're breaking down whether new high-tech lasers are the ultimate cure for dental implant infections. First, let's tackle peri-implantitis, which is basically bacteria-driven inflammation around a dental implant. While a recent 12-week study of 39 implants found something pretty awesome. Combining standard mechanical cleaning with a quick 30-second 940-nanometer diode laser treatment reduced plaque and gum inflammation way better than just scraping alone. Think of the physical cleaning like a car wash and the laser as a high-tech detailing spray that neutralizes bacteria in those microscopic grooves the sponge just can't reach. Second, we've got to ask, does this mean lasers are a total cure? Well, no way. The laser actually did not beat traditional cleaning when it came to actually reattaching the gum or reducing pocket depth. So it's a fantastic, totally painless add-on, but absolutely not a replacement for your hygienist's traditional physical cleaning. Finally, let's look at how we actually track your recovery. Interestingly, lab markers for inflammation, like S100A8, didn't actually drop even when the gums looked better. So why the mismatch? Simply put, biological microscopic shielding just lags behind visual healing. That means those old-school clinical exams by your dentist are still much more reliable than lab tests for catching issues early. While laser therapy is an amazing sidekick for fighting implant infections, regular professional maintenance and early diagnosis are still your absolute best defense for a healthy smile.